everyone. Welcome to another episode of Healthcare Unlocked, the show where we break down big health topics in simple, real life conversations. This is episode 5, Trust Your Gut. I'm Tara, and today we're joined by Nigel James. So he's here to tell us about your gut health and what's going on in there. Please introduce yourself.
Hello, everyone. I'm Nigel James, one of the gastroenterology specialists. So here to talk about everything related to your gut health and the digestive system as a whole. Thanks for having me. I appreciate it.
No, thank you for joining us. I'm glad you sat down here on this live and can answer some questions for us. We're talking about your gut today. So tell us a little more about GI and what it is.
Okay, great. So GI or gastroenterology is the discipline or the study of your digestive organs. This misconception that, GI is just, study of your stomach. You just want to uh, go over issues with your stomach alone, but the GI system is actually very broad. It encompasses many different organs. So the mouth, the esophagus, your stomach, your small and large intestine, as well as like liver, pancreas, spleen. It's a bunch of different organs, including the stomach.
So basically, if food goes through it, GIs know everything about it.
Absolutely. Absolutely.
Okay, so let's talk red flags. Some people think that you only go to a GI when you're really, really sick, but say there are surprising signs that could mean something deeper.
Yeah, so there's a lot of red flags that we need to look out for. Some people look at GI ailments as just stomach pain, but there are red flags including blood in the stool or unintentional weight loss, persistent or long-lasting gas, or changes in your bowel habit, meaning like if you are having chronic constipation or diarrhea or even both. These are some red flag signs that we may need to look into a little further.
Okay, I mean, poop, we're already going there. We're having an unfiltered conversation. So
Yeah.
here's something people don't really think about. You said don't rush to bariatric surgery, see a GI first. Let's go there. Why is that?
Yeah. So a lot of GI related issues, are surrounded by, excessive weight. So some people try to or want to go to a bariatric surgeon, but there's a lot of, GI related implications that could be done to help with weight loss and, treat some of the ailments associated with obesity and excessive weight. Um, so we want to focus first on like dietary changes, also lifestyle changes and modifications, things such as that.
Awesome. I love that you help patients find non surgical solutions to weight loss.
Yeah, exactly. So surgery, we usually want to regard that as the last case resort. There's other ways that we can help patients with like medication, lifestyle modifications. We also work very closely with nutritionists and dietitians who can, maybe put patients on, dietary plans that could benefit their overall GI health.
Okay, so on the topic of nutritionists, should we go see a nutritionist first or a GI?
It depends on what the problem is, but we do work very closely with nutritionists. So there's situations where you can maybe come to a GI and we could refer you to a nutritionist, depending on what the scenario is. But I think the two is more of a symbiotic relationship than one or the other.
Yeah, so you guys work together once the issue is diagnosed, is what I'm hearing.
Correct.
I
Correct.
see. Okay, so let's move on and bust some myths about GI. I'm going to throw some at you. Tell me if they're true, if they're not.
Mhm.
Ready?
Yes, of course.
GI doctors are only for old people.
Definitely not. Definitely not. So, that may be a common misconception, but there are GI related issues that, you could get as early as teenagers. We see a lot of teenagers with celiac disease or, young adults with IBS, which is irritable bowel syndrome. So it's definitely not just geared towards older people.
And can we contribute that in teens and younger people to genetics, maybe?
Possibly. There is some genetic predisposition with a lot of GI related issues. Definitely.
Okay. Next one. If it's just gas, it's not serious.
Okay, so that's a good one. So if it's just gas, it's not serious. So I'm guessing that means you just think that it's just people get bloated all the time. People have gas here and there every now and then, and usually it's not a big issue. But persistent gas, maybe at times where you're not eating something that you would generally think would cause gas, just gas that is lingering or excessive could be, a deeper issue that we may need to look into a little further.
Okay, I see. And if it doesn't hurt, it's probably nothing.
So another common misconception. So with that, I would give an example of hemorrhoids, for example, right? So hemorrhoids can be a leading cause of painless rectal bleeding. You could have internal hemorrhoids that can cause bleeding. You may not feel pain. So that's something that, we may need to do some further diagnostics to look into for the source of bleeding. But that's the first thing that I could think of that, could be something a little further of importance to look into.
That's when you go need to see a GI, especially if you're in fetal position on your bed and crying for pain.
Yeah. So pain, pain in itself, you should see medical attention if you have some consistent abdominal pain, or even rectal pain, which can be caused by hemorrhoids. Definitely, I would suggest seeing a gastroenterologist for
Yeah.
further evaluation.
Okay. So we already mentioned pain, bleeding. What other warning signs would you tell people they should not ignore no matter what?
Great question. So I would say a big one is unintentional weight loss, right? In this day and age, a lot of us going to the gym, trying to get fit. That's important. But if you are, just living a normal, regular, everyday lifestyle, you're not super, super active, and you notice you, for example, lost 10 pounds in a month or something like that, that's something that you shouldn't ignore. Something that uh, it could be related to a GI ailment, malignancy. We screen for things like colon cancer, usually starting at age 45. Um, and, we're actually seeing a lot of younger people with colon cancer. So sometimes their only symptom may be weight loss that's unintentional. So that's something that you should look into.
What do you think is causing the colon cancer in young people? That's really interesting that we have this shift now.
Yeah. So there's still a lot of studies being done out there, but a lot of colon cancer is related to a genetic predisposition. We're also seeing some studies done with dietary correlations and excess of processed foods, foods that aren't necessarily beneficial to us. We eat fast food, we're on the go all the time. Also, like smoking can predispose you to colon cancer as well, among a couple of different things.
So basically, you're just telling us don't ignore the body signs. your body keeps the score. When it screams, you gotta go, you gotta make that appointment, and you gotta listen.
100%, 100%. So a lot of people, we tend to ignore certain things, brush it off because we live our busy lives. But there are some red flag signs, like we mentioned, like rectal bleeding or unintentional weight loss or consistent change in your bowels from, constipation that's unusual for you, or diarrhea that's unusual for you, or longer lasting than usual. There's a lot of things that can happen GI related that you shouldn't ignore.
Right. I mean, some of these things just happen once or twice, or maybe every day, or it's just some signs that you don't really see or that you don't notice a difference. I want to know, what is the most common diagnosis that you find with your patients?
That's a great question. I would say one of the major symptoms or complaints is acid reflux and excessive bloating, gas. This is usually under the umbrella of something called GERD, which is an acronym for gastroesophageal reflux disease. In my population, there's a lot of people who are obese, overweight. These are risk factors for GERD. And pretty much what that is, in our esophagus, which is the tube that connects the mouth to the stomach, there is a small muscle at the lower end of that esophagus, and it's called the lower esophageal sphincter. So certain foods that we eat, such as spicy foods, fried foods, oily foods, can contribute to worsening of the acid in your stomach, and also relaxation of that muscle, that sphincter that's supposed to stop acid from coming up into your esophagus. It's supposed to stay in the stomach. A lot of the foods that we eat could contribute to that, and also smoking could relax that esophageal sphincter. Also, an excess of pressure on our abdomen can cause that sphincter to relax and cause acid to come up into our esophagus. So being overweight, pregnant women, um, these are risk factors that can contribute to it.
Okay, so we gotta watch what we eat, is basically what we're hearing. I know some
Hmm.
of us really love spicy food.
For sure. For sure. Yeah. So spicy foods, fried, oily foods, fatty foods, these things could definitely worsen it.
So with GERD, can you fix it with your nutrition, or do you have to go into medication?
Great question. So a lot of GERD, I think that also depends on the cause of it. So there's different causes of GERD. Like one category, I guess, being food, or um, the way we intake food. Also, there could be a cause of something, or a cause could be something called a hiatal hernia, which is pretty much we have our chest cavity, which holds our heart and our lungs, separated by a muscle called the diaphragm. So that diaphragm separates the abdominal cavity, which contains your GI organs. So what a hiatal hernia is your stomach, which is located in your abdominal cavity, slips up into the diaphragm, into your chest cavity, and that squeezing of that slippage can
Mhm.
cause the acid from your stomach to come up into your esophagus and worsen the condition. So in large hiatal hernias, the treatment may be surgery, as opposed to with the food being the cause, the treatment is just dietary changes, decreasing the acidic or spicy foods. Um, there's another cause, which is a bacteria called Helicobacter pylori, which can uh, increase the acidity in your stomach. And you can get that bacteria from contaminated foods and things like that that can contribute to GERD as well.
Got it. All right. Thank you so much for answering those questions. Basically, all that we've learned is that your body will show you the signs when you need to go to a GI, and you better listen.
100%. You got to listen to your body.
So, what's one thing you want our viewers to take away from this live?
um, so the reason why I like GI so much and the specialty of GI is because it is more to it than meets the surface level, right? Like many people have this misconception that GI is just the study of your stomach or the study of stomach problems, but there's so much correlation between the GI system and all the other systems, right? So we have sort of a community of trillions of different bacteria in our gut that contribute to fatigue, the way we think, the way we um, have our good skin. Like those type of things are all related to your gut. So this trillions of bacteria and makeup of good and bad bacteria, it has a connection to your brain. So it's regarded as our second brain in a lot of people. And the reason for that is because the gut and our brain, they are in constant communication with each other. Actually directly through a nerve, the vagus nerve, which is one of the cranial nerves. And with this connection, if you have this community of bacteria that's more bad bacteria than good bacteria, then that the signals that they bring to the brain are going to be bad. You'll have effects of mood disorders and chronic fatigue and acne and all of these different ailments. That's why I think it's so interesting. So the takeaway point I would say is to take care of your gut bacteria, right? So things like probiotics and prebiotics, which are introducing good bacteria to your gut, and the prebiotics would be the food that the good bacteria feed off of. I think that could be beneficial in a lot of cases. Um, and I think there should be a healthy balance of good bacteria so that, your general health could reflect that.
Of course. Well, thank you for telling us a little bit about why you're interested in GI and why we should care. It's very interesting to know how it's considered our second brain, but I don't know why we wouldn't think about it day to day when it affects our daily life, as you said, our
Right.
acne, our mood, our brain, everything. But before we let you go, we do have a few questions from the audience.
Okay, sure.
First one being, can stress actually mess up your gut?
Okay. Yes, stress can mess up your gut. So stress can actually slow down or even speed up the your digestion. So it's like it can cause an imbalance of your microbiome, which I spoke about before as well. Um, the general answer is yes. So try not to be stressed out. It's easier said than done. We understand, but definitely stress can contribute to poor gut health.
I see. I mean, it is your second brain after all. If stress affects your main brain, then it's affecting
Exactly.
your gut too.
Exactly, because they're in constant communication all the time.
Right. So, is taking probiotics daily necessary, or is that just capitalism and the hype and
Mm.
influencers?
Good question. So it really depends. So taking daily, it's not, I wouldn't call it a necessity, because it's something that, probiotics you can get from your foods, right? You can get it from, you don't have to take it in supplement form in a pill every day. You can take it from everyday foods like yogurts or, kombucha, also kimchi. These are things that you can get like natural live probiotics from. Um, but it can be beneficial. in a lot of cases, but it's not necessary.
I wish you would have never told me that. I'm gonna go eat a bowl of kimchi as soon as we finish this.
It's good. It's good.
So, why do I bloat even when I eat healthy? Is a question from one of our viewers.
Okay, that's actually a great question. So, bloating when you're eating healthy. So, sometimes it could be a link to maybe early IBS, irritable bowel syndrome. There's certain foods that we may think it's healthy, but for a person with IBS, it may not be as beneficial as we think. So, we work in coordination with the nutritionists, and we tend to put these patients on something called a low FODMAP diet, which is essentially fermentable. Um, Going through the acronym is so oligosaccharides, disaccharides, and monosaccharides. So these are basically sugars that are located in certain foods. So disaccharides include like people who are lactose intolerant. You know, also monosaccharides are foods like pears and apples and regular fructose that you can get. Uh, some people may not agree with it. They think, oh, their gut may not agree with it, but they may be seemingly healthy. So apples and pears and things like that. So in those cases, those people shouldn't eat that healthy.
Well, as somebody who is lactose intolerant, I can confirm.
Mhm.
Another one of our viewers says, can gut issues really affect your skin?
Yes. So gut, going back to the microbiome issue, so there's something called, in addition to the gut and brain axis or gut and brain, connection, there is also a gut and skin connection. So the same way, the brain signals back and forth between the gut does the same with the skin and the bacteria on the skin as well. So if you have a poor or imbalanced gut microbiome, it can manifest on your skin as like acne or psoriasis or certain other dermatological problems. And again, that's why I love GI so much, because it coordinates with dermatology, it coordinates with neurology, so many different other disciplines, and it's not just stomach and that's it.
Yeah, and bariatric and nutritionist, as we already spoke during this live. Okay,
Exactly.
last question. What's one food you would tell patients to avoid for better gut health? That's a hard one.
Mm. That's a difficult one. So I'll leave that to the nutritionist. No, I'm joking. But there's no one food for people to avoid. Everyone is different. Some people may be lactose intolerant, so I would have to tell them not to take that, obviously. But um,
Maybe
you
like
know,
a group of food.
a group of foods,
Hmm.
as cliche as it sounds, like anything that's processed. So anything that's processed, fast food, things with excess sugar, these things could, contribute to a worsening or poor gut health. So try to avoid excess sugar.
All right, that's going to be hard moving on. But thank you so much for your honest and expert answers. We really appreciate you taking the time to talk with us. And thank you for our viewers for sending in those questions. We do have other questions, but unfortunately, we're running out of time. So head over to our Instagram where we will answer everything on our IG stories at Healthcare Unlocked. Any final advice?
Final advice, I would say, take care of your gut. So, as cliche as that sounds, so that means, your gut microbiome, those bacteria or that colony of bacteria that's in your gut. It's important to have a healthy balance, because it could affect so many other parts of your life. We talked about mood and your skin, also sleep. There's so many different manifestations that you could see in everyday life that could just be coming from your gut itself.
I'm going to be thinking about this live for the next few years every time I go to eat something. So thank you so much. That
Not
is
a
a wrap on episode 5 of Healthcare Unlocked. Thank you so much, Nigel James, for unlocking the gut game for us. If you found this helpful, share it with your auntie, your uncle, your fam, your group chat, your wax lady, your eyebrow lady, your barber, anybody who you think might find this
right.
useful. I mean, everybody has a second brain as their gut. So share with them so they know what to do and what not to do. Don't forget to follow us on Instagram, Facebook, YouTube for more episodes like this to unlock the healthcare game. Thank you.
Thank you guys.